I am a nurse. In the world today, there's nearly 19 million nurses. In the United States, nearly 4 million if we add LPNs and RNs. In 2010, the average age of a United States nurse was 50 years old. We extrapolate that 8 years forward. The average age of a nurse in the United States is 58, meaning 50% of our nursing workforce is over the age of 58. 70% of our nursing workforce is over the age of 40. With this rapidly aging demographic, it is projected that we are experiencing a nearly 1 million nursing shortage by the year 2020 to 2025, based on the rate of retirement. With that, it means that there's great opportunities in the career of nursing. However, the schools of nursing are putting out about 250,000 nursing graduates per year. But there is one statistic that we don't talk very often about, which is 50% of our new nursing graduates are leaving the bedside within 2 years of practice. My husband asked me, Rebecca, why are 50% of nursing graduates leaving the profession of nursing within 2 years of practice? That seems insane. I said, well, honey, when you graduated business school, were you expected to do the exact same amount of responsibility as that of the CFO? And he said, well, of course not. And I said, well, in the world of nursing, when you graduate, not only do you take care of the same number of patients as a new grad, but you take care of the same level of acuity of patients as those nurses who have 30 years of experience. Suddenly, you're 2 years out, and you're looking at your friends who went to business school who are working Monday through Friday, 9 to 5, and they're probably making $10,000 to $20,000 more than they did when they graduated. And you're looking at your schedule of a day-night, holiday, weekend rotation, and no real increase in pay because nursing wages have been repressed. And you wonder to yourself, was nursing the career that I thought it should be? A few months ago, Dr. Hanrahan and I were flown to a meeting with chief nursing executives from around the United States to talk about the issue of retention in nursing. Because currently in the United States, we lose 17 to 19% of our nursing workforce every year in the hospital system, costing us an average of $1.5 billion in healthcare costs. So we focused on why retention needed to happen. And we discussed these programs. Well, what if we created these vertical programs that when nurses graduate nursing school, they spend 2 years on the medical surgical floor, then they move on into the ICU and ER and see that there's a career future for them. So one of the chief nursing officers spoke up and said, we did this at our hospital. But even though it increased retention, we had to shut down the program. So we pushed her on this. Why would you shut down a program that's driving up retention? And she said, well, the managers on our medical surgical floors were upset about keep training and losing their best nurses to the other areas of the hospital. But the problem was, as opposed to losing these nurses to the other hospital areas, we lost those nurses altogether because they still left the bedside. The definition of insanity is to keep doing the same thing over and over again and expect different results. And in the world of nursing, I think we all believed that nurses were just going to be there, that there would always be a nurse at the bedside to care for you in your worst moments. But the reality of the situation in nursing is that we are facing one of the greatest time of threats to the future of our nursing profession if we don't start to look at the profession differently and engage the next generation to understand that if you want to be at the forefront of healthcare innovation, you want to be a nurse. And to tell you the truth, there happens to potentially be some hope. And the truth is, can a hackathon really save the future of nursing? In a sense, it did that just for me. So a few years back, I was a struggling nurse entrepreneur. And a friend of mine who was also a young entrepreneur said, Rebecca, you have to go to this healthcare hackathon. And I said, Nick, what is a hackathon? I've never heard of it. And he said, well, it's this 3-day event where people show up in a space and they pitch healthcare problems, create teams, and over the course of 56 hours come up with solutions to those problems, pitch a team of judges for cash to start their business. I said, that is so for me. So I go, I attend the 3 days, join a team. Our team comes in second place. and it was a revolutionary experience for me. Over the course of a weekend, I learned more about the business of healthcare than I had learned in a year of trying to start a healthcare business. It inspired me so much that I started to study the environment of healthcare hackathons at hospitals around Boston. And what I realized was that a very small percentage of nurses attended these hackathons, but a significant majority of the teams that won had nurses on their teams. I hypothesized that nurses had the practical experience to bring forth the best solutions to create the most innovative healthcare solutions to tackle our biggest problems. So I decided that there had to be a nurse hackathon because there had never been one. I randomly decided to pick up the phone and call Northeastern University. And lucky for me, I was connected with one of the most visionary and leaders in nursing today, which is Dr. Nancy Hanrahan, who at the time had just been appointed to Dean of the School of Nursing at Northeastern. I told her about my experiences at this hackathon, and she said to me, "Rebecca, I'm going to do this summit on innovation and entrepreneurship. Why don't you run a hackathon?" And I said, "Well, I've been to a hackathon. Sure, I'll run a hackathon for you." So that's where the adventure began. The truth is, if you look over academic writings over the last 5 decades, nobody has written about nurses as innovators or entrepreneurs. Nobody has ever studied it. I can tell you there's less than a handful of papers on this topic. So we weren't sure if anyone was going to show up, if nurses would come, if people believed that nurses should be innovators and entrepreneurs. And suddenly, 2 weeks before that event, we have 250 people signed up and we're sold out. And Dean Hanrahan calls me and she says, "Rebecca, where do we go next? We can't just introduce nurses to innovation, entrepreneurship, have them start products, create new processes, and challenge the status quo in conventional medicine with new ideas and leave them out there by themselves. So I need you to come on as the Director of Innovation and Entrepreneurship for the School of Nursing." That was June 2016, and in the last 18 months, we've run 22 innovation events, directly touched over 1,000 nurses. 4 of our teams from our last 2 hackathons have gone on to start companies and file patents, and 7 of our nurse practitioners who came to our Nurse Practitioner Entrepreneurship Conference have gone on to open up their own healthcare clinics in the last 6 months. We are driving discussion, conversation in a way that has not happened in nursing in nearly a century. Some of the major organizations from the American Nurses Association, AARP, and Johnson & Johnson are calling us to ask, how are you doing it? What are you doing to reinvigorate the nursing population? The truth is, none of us should be surprised by this, because nurses are natural innovators. You give a roll of tape to a nurse and watch as they MacGyver by the bedside. But the truth is nurses are the end user of nearly every medical product on the market. They are in daily contact with hundreds of thousands of dollars of medical equipment, technology, and medication to keep patients alive the 23 hours a day the physician is not in the room. But what you may not know is that nurses are not engaged in the conversations on how to make these medical products or which products to buy and put in the hospital floor. As the end user, they are not engaged. I can't tell you how often as a young nurse or as an older nurse, I have been introduced on hospital floors new technologies that were rolled out that actually made more work for us. There was one system that was rolled out to us as nurses that we wore around our neck as a communication tool. The noise is going on around us. This machine is yelling at us. The doctor's on the phone. Your blood products are ready. So-and-so needs a glass of water. By the end of the day, we had taken off this device and put it at our nurses' station. Imagine if they had come to us at the beginning and said, "Hey, how does that work? What do you think of this?" and developed that product with the nurse. Because imagine if they had engaged the nurse at the beginning, how would it drive down healthcare costs and increase patient outcomes in significant ways? Because right now, nurses on average are doing 27 workarounds per shift, and they are in 36 different places per hour. What that tells me is that nurses are innovating in a highly inefficient healthcare system that is ripe for disruption, and the reason it continues to fail is because nurses have not been engaged in these decisions. Where are the nurses? Why are they not in the boardrooms? A colleague of mine who I was recently on a board with, the chief nursing operator of Microsoft, yes, Microsoft has a chief nursing officer, her name's Molly McCarthy, said, if you're not at the table, you're on the menu. And the truth is, nursing by far has too often been on the menu and not at the table. And the truth is Dr. Hanrahan has said, it's time that nurses come to nursing school, not only get educated with a strong clinical toolkit and leave with a stethoscope, but they need to understand the business of healthcare and also leave with a briefcase. Because when we can speak the language of healthcare business, we're going to be able to revolutionize healthcare innovation. And the truth is the time is now, unlike any time that we've seen before for this to happen. I, as a nurse, was taught to be empathetic. I was told to speak to I think, I feel, I believe. But in comparison to arguments of financial projections, operational strategy, and the bottom line, I think, I feel, and I believe pales into comparison into what the skill sets I need now to drive forward healthcare. The truth is, the history of nursing started with innovation. This woman is Florence Nightingale. And in the 1850s, she served as a volunteer during the Crimean War. She was a highly educated woman, and she sent a letter to the British government. And she said, if you had wanted to create a place worse than hell, you have succeeded. For as she watched the soldiers come in from the battlefield with injuries, she saw that they did not die from the injuries they sustained on the battlefield, but from what she supposed was the disease and infection that she watched as physicians went bedside to bedside without washing their hands or sterilizing their equipment. She challenged conventional medical practice, the status quo, to say this needs to stop and that sanitation is equal with godliness, and therefore created what today is still the best practice for stopping the spread of infection, which is washing hands and sterilization. That is what founded nursing. Innovating to drive healthcare outcomes forward and patient outcomes stronger. Florence Nightingale did say as well that if none in the world were discontented, the world would never see anything better. Right now, the world of nursing is very discontented. But based on her words, we stand at no greater time in history than to innovate and change the direction of nursing to lead to the next direction of healthcare entrepreneurs. People ask me, Rebecca, why are you working 60 to 80 hours a week, spending your weekends trying to get this message out there? And I say, I'm running so fast and so hard at this because I'm concerned that this might fail, and someone is going to say, nurses tried to be innovators. They tried to be entrepreneurs, but they failed. And for the next century in front of us, healthcare innovation will stall because we didn't give the opportunity and the skill sets to nurses to be able to revolutionize the future. There is so much more to say and so little time that I'm going to leave you with this. A colleague and friend of mine by the name of Shauna Butler, RN MBA out of Texas, said one day she was looking at the word entrepreneurs. And she said in healthcare, it's always been spelled wrong. If you just simply moved the E to the end, you'd have entrepreneurs. So ladies and gentlemen, I'd like to welcome you to the future of healthcare innovation and leadership and the chance for the most revolutionary change that we've ever seen in healthcare. Welcome to the era of the entrepreneurs. Thank you.